Good afternoon and welcome to the Parkinson Association of Southwest Florida's Mat Exercise class. I'm Marjorie Johnston, an ACE certified medical exercise specialist. In this class, first we'll do a warm-up in the chair before we proceed to the floor. As I'm sure you know, exercise is extremely important for Parkinson's disease. Some doctors say it is as important as the medication. We will be doing a warm-up, then we will move to the floor. We'll be doing some stretching and other movement exercise. Please remember to work at your most comfortable pace. If an exercise doesn't feel right to you, you can make it smaller or slower or avoid it. Please follow your doctor's precautions if appropriate and listen to your body. We'll begin with a few exercises to warm up the muscles and lubricate the joints. Let's set your alignment and your posture. Sitting up straight in the center of your chair with your feet flat on the floor. Your ears line up over your shoulders line up over your hips. Chest is lifted, abdominals tucked in. We're going to start with an overhead reach. Reach up, other arm, two more. Reach both arms up, stretch up, deep breath, and exhale and down. And hold it here. Head turns, turn your head over your shoulder. Other side. Try and turn a little bit further each time. And back to center. Drop your chin, lift up, and drop, and lift up. One more, drop, and lift up, and back to center. Push forward, pull back, push forward, pull back, push forward, and pull back, and center. Shoulder rolls, lift the shoulders up, press back, and press down, up, press back, press down, up, back and down, up, back and down, and spinal flexion and extension. So you're going to slide the ribs down to the pelvis, round forward, tuck your chin, and reach forward, feeling that stretch along your spine. Lift up, bring the hands back, press back, squeeze the shoulder blades together, lift the chest, and forward, round forward, press back and lift. Last one. And bring your hands up to center. Okay, keep your hands right in front of your chest. We're moving from the waist side to side. And turn, and turn. Try and turn a little bit further each time. One more each side. And back to center. Stretch your arms out. Bend to the side. Come up, squeeze back. One arm stretches down, the other one stretches up. Up, squeeze back. Try and go a little bit deeper this time. See if you can touch the floor. Last one. And stretch one leg out. Heel down, toes up, nice and straight. Both hands on your bent knee. Hinge forward till you feel the pull on the back of your thigh. Come on up. And forward again. Up. And forward. And up. And one more. Forward. And up, and change legs. and forward. Feel the pull in the back of your thigh. A little bit deeper this time. And one more. And up. Now we're just bending all the way forward. A little bit more of back stretch. Come on up. Put your hands in the middle of your back. Lift the chest. Press the shoulders and the head back. Come back to center. Take a deep breath. And exhale. And now we're going to get our mats and get to the floor. Let's just take a moment so that we can get down on the floor safely. So first, spread out your mat. And then put your hands on the seat of the chair. Step back on one foot. Drop that knee to the floor. Bring the other knee to the floor. And then sit down on one hip. Bring your feet around. And we're ready to begin. Our first exercise is called a half rollback. And it's a Pilates exercise. You're going to slide the ribs down toward the pelvis and round your back. Stretch your arms out to the front. You're going to roll back as far as is comfortable for you. And then roll up using your core muscles and stretch forward. So it's roll back and up and reach forward. Roll back, exhale down, inhale up, exhale forward. So bring your feet up, stretch your arms out over your knees, and round your back. Roll back as far as you can comfortably, and pull back up again and stretch forward. Yes. Roll back, exhale on the way down, and stretch forward. Nice. Exhale down, pull up, and stretch forward. Exhale down, and pull up, and stretch forward. All right, now all the way back, please. Keep your knees bent, keep your feet flat on the mat. If you need it, pull your blue cushion under your head like a little pillow. Make sure it's just under your head though, and not under your shoulders. Okay, our next exercise is called the Windshield Wiper. You're going to roll down on your mat and make sure your head is on the mat. Now, if your head is up a little bit and you can't get to the mat, feel free to use a small pillow. Bring your feet close to your seat. Stretch your arms out from the shoulders. You're going to drop both knees to one side, and you're going to turn your head to the opposite side. Come back to center, and drop your knees to the other side, and look. And up to center. And up. And down. And up. Bring your knees up. There. Stretch your arms out. Good. Now we're going to drop both knees to the right and turn your head to the left. And back to center. And drop your knees to the other side. And turn your head and pull back to center. And drop your knees to one side. Turn and look to the other side. Not so fast. Good. One more time. Drop your knees to one side. Turn your head to the other side. And up to center. This next exercise is a progression of the windshield wiper. So you're bringing your knees up over your hips and your lower legs are parallel with the floor. You're dropping your knees to one side, using the core muscles, turning your head to the other side, and back up to center, drop to the side, and up to center. Exhale down, inhale up, exhale down, inhale up. Now I want you to pick your feet up off the floor and your lower legs are parallel to the floor. Take a deep breath and drop your knees to the side. Inhale, back to center. Now if this is too much of a challenge, you can keep your feet on the floor. Exhale, drop your knees to the side and pull back up to center. Exhale, drop your knees to the side, pull up to center. Exhale, drop your knees to the side and pull up to the center. One more time, drop your knees to the side, pull up to center, and the other side. Yes, and up to center. You're doing fine. Push your feet down on the mat. Good. This is another Pilates exercise called the shoulder bridge, and it helps to strengthen your lower back. Lift your hips up off the floor so that the only parts that are on the floor are your 2 feet and your shoulders. Hold it here and then slowly relax down. And again, lift up, press up, hold the position, and relax down. And now we're doing shoulder bridge. So your feet are flat on the floor. Bring your hands down by your side. Now you're going to lift your hips as high off the floor as you can. So bring your knees up and lift the hips so that's it. Very good, Alex. Excellent. Hold it, deep breath. And exhale. And relax down. Good, let's do that again. Lift your hips. Deep breath. And exhale. And inhale, lift up. Deep breath, 2 of them. Exhale. And inhale. And exhale. And relax down. This next exercise is a progression of the shoulder bridge. So push up into a shoulder bridge. You're going to extend one leg up. Bring it back to the floor. Extend the other leg up. Bring it down to the floor and lower down. And again, press up, extend up and down, extend up and down and lower down. Okay, this is spinal rotation to the left side. The leg that's on the floor is straight, the top knee is bent and on the floor. Both arms are in front of you. You're going to lift up. Inhale as you lift up. Exhale as you lower all the way back to the floor behind you. Inhale up and exhale down. Inhale up. Exhale as you lower to the floor behind you. Inhale up and exhale down. Now this third one we're going to hold a little bit longer. Inhale up, exhale down. Hold it here, take a deep breath. Exhale. Inhale up to center and down to the front. Onto your right side, please. Good. Stretch your arms out in front of you. Now the bottom leg, the leg that's on the floor, is straight. The leg that's on the top is bent. And the knee is on the floor in front of you. Good. Now you're going to lift the top hand and inhale, stretch back, and back over again. Oh, that looks nice. Good. Inhale up, exhale down. Keep that knee on the floor if you can, and back to center. Good. Stretch both arms out in front. Okay, the top knee is bent. So inhale, bring the arm up to the ceiling. Exhale, drop it back behind you. Good. Inhale up to the ceiling and down in front of you. Good. Again, inhale, exhale, drop back. Inhale, and back to center. Inhale up to the ceiling. Drop your hand and your arm back behind you. Up to center and over. All right, one more. Inhale up. Drop the arm back. Stay here. Hold it. Deep breath. Exhale. And over back to center. And now I'd like you to get up onto your hands and knees. So push your shoulders up, both hands. Lift your hips up. Your hands are directly underneath your shoulders. Your knees are directly underneath your hips. And you're going to rock back and rock forward. And rock a little bit more each time until you're all the way back into a shell stretch and forward into a swan dive. To a shell stretch and a swan dive. Your knees are right under your hips. Your hands are right under your shoulders. Bring your toes together and your heels apart. Sit back on your heels. Stretch the arms out forward. And now lift up, press forward, lift the chest, lift the head. If it's available to you, drop the hips toward the floor. Step, stretch back. This is called a child's pose in yoga. And forward. And up. And child's pose, back. And up. And forward. And hold it here. Take a deep breath. And exhale. And child's pose. To center, hands under your shoulders, knees under your hips. Now I want you to stretch one arm forward and down. Stretch the other arm forward and down. Stretch one leg out to the back wall and back down. Stretch the other leg out to the back wall. That's good. And you can make modifications as you need to, like Alex. Alex is on his elbows, and that's fine. So we're going to stretch one leg to the back wall and the opposite arm to the front wall. Tighten those abdominals. Deep breath. Hold it. Exhale. And come on down. Now, again, if this is too much of a challenge, you can just lift your legs to the back and keep the hands down, because it is difficult to balance. Stretch the other leg. Reach out. Deep breath. Exhale. And down. Change sides, other leg and other arm. Inhale. Exhale. And change. Stretch back. Reach forward. Opposite arm. Inhale. Exhale. And down. All right, and now stay right there. We're moving into a plank. Let's try a plank. This can be a challenge, but it's worth the effort. Curl your toes under. Try and keep your body in a very straight line and gently lift your knees off the floor. Hold that position and then relax down. Sit back. Do it again. This time, try to hold it a little bit longer. Straighten, gently lift your knees off the floor and hold it. And gently put your knees down and sit back. Lift up onto your knees. Press back. And down. Reach forward. Up. Press back. Reach forward. Come up. Reach up overhead. Lift the chest. Reach a little bit back if you can. And down. Sit back. Come up. Reach back. Hold it here. Now you're going to reach one hand down to the opposite heel. Up. Other side. Down. Up. And down. And up. And down. And up. And bring both arms down. And now, bring one leg forward. Both hands on your bent knee. Bring it as far forward as you can. And lunge. Stretch into it. Press back. Change legs. Up. Press forward, lunge. Okay, put your hands on your knees, Alex. Press back and change. And bring the other leg forward. Put your both hands on your bent knee and lean into it. Okay, I need you up. There. Put your hands on top of your knee. Keep your head up and lean forward and stretch. Good. And back, and change legs. Bring the other knee up. Stay up. Keep your head up. And bend the front knee for a stretch. Good. Lean into it. And back. And bring that knee down. All right. And now, adding a little to it. Bring one knee forward. Lunge. Keep the chest up. Keep the head up. Reach one arm up. Reach the other arm up. Deep breath. Exhale. Bring both hands down onto your knee